Welcome to ACTPod, a podcast show that sheds light on the stories and impact of the social sector. The show is proudly powered by Aspire Coronation Trust Foundation. Let's begin the change.
Hello and welcome to ACTPod, our story, our continent, and happy International Women's Month. This one definitely is about the women, and today we'll be having a very interesting conversation, a much needed topic of discussion. We'll be talking about breaking the silence with regards to gender-based violence. And today we'll be telling a beautiful story. It's called the WARIF story. Do you know WARIF? Okay. You know a lot about WARIF today. I have the founder of Women at Risk International Foundation, that's WARIF, and she's in the studio with me today, and that's in person of Dr. Kemi DaSilva Ibru. Welcome to ACTPod.
Thank you so much for having me.
It's so good to have you. Today, we'll be having this very beautiful conversation just to mark the month, the International Women's Month. And I love the fact that we're going to be telling your story, which is the WARIF story. You represent WARIF, right?
Indeed, I do.
Okay, so we'll be talking about this story. But before we get into that, we'd just love for you to tell us a bit about yourself.
Okay, so my background is healthcare. I'm a practicing obstetrician and gynecologist. I've been working in the private practice space now for over 20 years, spanning 3 continents. I'm also a public health physician with strong leanings towards women and gender issues. I was motivated to establish a non-profit organization, the Women at Risk International Foundation, WARIF, to address the prevalence of rape, sexual violence, and trafficking of young girls and women in communities across Nigeria.
Okay, thank you so much. I see you've eaten a bit into my next question, but I'll still ask it all the same, and because I want to get a bit more information about what WARIF is. I was going to say who WARIF is, and what WARIF represents. So you founded this organization, and it's been almost 8 years now, right?
That's correct.
Okay.
It'll be 8 years in December.
Oh, wow. Congratulations in advance.
Thank you.
Okay, so what birthed WARIF, and what exactly was the journey I know you briefly mentioned that, but would really love to know what led to the establishment of WARIF. That was in December
2016.
Okay.
So, as I just mentioned, working in obstetrics and gynecology, my patient population are women and girls. So when I moved back to Nigeria, I started working in the public sector space in tertiary centers in Lagos State. And this was when I started to see young girls and women with harrowing, horrific cases of gender-based violence. And they were brought into these public sector facilities because there was a dearth of essential services available to them, especially specialist care facilities that could address these cases. In my health capacity, I offered my services pro bono, but very quickly realizing that there was so much more that needed to be done in addressing the cases and the well-being of these women. Beyond the physical injuries, there's the emotional component to it. Beyond the emotional component, you have to appreciate that we're not a welfare country, so there's this welfare aspect that needs to be addressed. And then you look at the bigger social drivers of why it's happening, and you appreciate that if you're going to address a problem of this magnitude that is so layered and affects every sector in our society, then you have to adopt a unique approach. In establishing WARIF, the first thing that we understood was a needs assessment, understanding the sheer magnitude. How many girls and women are we addressing? And statistics tell us that 1 in 4 girls before the age of 18 would encounter at least one violent sexual experience in Nigeria. Now, if you look at Nigeria as the largest populated country on the African continent, we're talking about 200 million people, and half of us are women. So we have 49.8% of women and girls, and we're a young country. So over 60% of us are under 24. So when you say 1 in 4 before 18, you're translating this to mean over 10,000 girls everywhere across our 6 geopolitical zones. And then I looked at the lack of essential services. The same data suggests that only 5% of these women are even aware of services that could be of benefit to them. And only 3.5% actually receive any care. So in establishing WARIF, it was very apparent that we needed a unique approach. We needed to look at the intervention, offering services to these women and girls that are disenfranchised. But beyond that, we needed to look at the preventative measures. How do we tackle the issues so we prevent these cases from happening? So our approach is healthcare, which is our health pillar, our educational pillar, where we offer measured, impactful programs, both to secondary school boys and girls, as well as university students. And then the community pillar, and this is where our relationship with ACT Foundation started, where we offer, again, measured programs that are impactful, but this time in rural communities. Because we must remember that 54% of Nigeria is still within that rural community. If I speak a little about the educational pillar, we have to also appreciate the number of universities that we have in this country. We're over 170 universities. And in every university, you have an average of 1 in 5 students coming forward to say they're survivors of school-related gender-based violence. So we were fortunate enough to partner with other funders, and we were able to implement the first ever online classroom targeting this issue. With our secondary schools, we appreciate that the most vulnerable age group is that adolescent schoolgirl. 78% of the cases that we see at a rape crisis center in Yaba are under the age of 18. The youngest is only 7 months of age, and the oldest is 68. So it tells you that this is an issue that affects everyone, both girls, children, women, and of course men, because the community is also held accountable for these acts of violence.
Oh, thank you so much. I love the fact that you went on to talk about the approaches that WARIF has adopted over the years. One question that just comes to mind as you speak about this is how receptive have been people, communities, institutions, been to WARIF since it started and its interactions with the community and especially with helping girls? What has been the reception? Has it been good so far? Has it been encouraging to keep up with the work?
To answer that question would be twofold. First, we appreciate the social drivers of why do we have these acts of violence in this part of the world. Like most low middle income countries, there's a patriarchy. We know that women are naturally subjugated regardless of whether or not there's a violent encounter. And then we know our traditional practices encourage, in some situations, these acts of violence. And then when you ask about the community on some level is also complicit because we name, we shame, we blame, many a time not necessarily the perpetrator, but then we allow this survivor to carry the shame and the burden of these acts. And so how do we break that silence, as you spoke of? How do we then address that? We have to go back into the community. And so awareness was key and was critical. And in raising awareness, we started to appreciate that there were actually individuals, organizations that were already doing good work, but working in silos. And so we appreciated the fact that we needed to now improve on our collaborative efforts. We started to work with both governmental and non-governmental agencies. We started to partner with Lagos State. We're now official proud members of the Domestic and Sexual Violence Agency. We recognize that for us to shift that needle, for us to actually tackle this problem and see traction, we couldn't do it alone. So in working with organizations, both in the government and outside, in recognizing that we needed to raise the awareness of bystanders, of you and I, so that we see that this is not just a governmental problem or a societal problem, but this is a human problem that affects homes and communities. And so we're all asked to pick up that baton and we're all asked to play our role. And we're seeing this change, and it's really exciting to see because that's the only way that we can actually remove this scourge, if you will, in our communities.
Thank you. Thank you so much. Now, I want to talk about some of the stakeholders that you have to engage to get this work done. First would be the men and the boys. And I know you mentioned them while you were speaking. We know that we're talking about gender-based violence and the focus is on the women, but we know that the men and the boys play a huge role in stopping this scourge, like you've called it. So how has WARIF engaged men and boys since its inception till now in the fight against gender-based violence?
So the role of men and boys is critical to changing the narrative of gender-based violence, especially again in an environment like ours.
Yes.
If you empower a woman in a home and you don't carry her husband along, you're actually increasing her risk of intimate partner violence, because societal norms tell us that he believes that he's the head of the house. And so the status quo in that home is that she has no agency or autonomy in making decisions. So if you change that power status, if you empower her so that she can speak up and you don't carry him along, you can see where that leads to a perfect storm of increased violence.
True.
And so we recognized that very early, and we realized that we needed men as allies for us to actually move forward and successfully increase the essential services we have and also decrease the number of cases that were prevalent. We have 2 specific case studies and programs that we have implemented that we have found to have impact that we've been able to measure. With the secondary school boys, the adolescent boy between that age of 12 and 17, we found that his mindset at that time is still in the formative stage. And so if we were able to introduce to him like a mentoring program, allowing him positive masculinity and encouraging him to be that protector and not that perpetrator. Because we have to remember that this young boy is also institutionalized in that home of violence. So he sees it every day. So he doesn't actually see it as something that's wrong because it occurs all around him. And there's no positive masculinity to reinforce that this is wrong and shouldn't occur. And so we implement the Boys Conversation Cafe to these adolescent schoolboys across secondary schools in Nigeria. We're up to almost 2,000 boys now and counting.
Wow.
And we can see the measured impact in their change in mindset, in even the way they interact now in the home or in communities. And this we're able to measure because we go back and we have focal group discussion with their teachers and with their parents. In the community, we have a program called the Men for Allies. And again, this is a community-based program where we go into target groups and we encourage the men to come into our workshops. And then we start to speak again about this positive masculinity. And we start to encourage them in giving agency in their homes, in their communities, and recognizing why it is so important to actually empower the women folk in their communities. Beyond the fact that it's fundamentally right, it's actually an economically wise decision, because we know that women are not only the glue in the home, but even economically, she adds to the home. And so if she's empowered, it makes for a happier, healthier, and more productive community.
Awesome. Amazing. That's really beautiful to know that both the men and the boys are carried along. And now another group or category of stakeholders that we'll be talking about would be law enforcement agencies, would be religious bodies, and of course, policymakers. And I think that's where the government comes in and all. How does WARIF engage the stakeholders in changing this narrative?
So the stakeholders that you spoke of, many of them come with spheres of influence. I mean, you go into any community and you very quickly recognize that a very important stakeholder is that religious leader or that traditional leader. And you also recognize that they're all natural mediators to many of these cases of violence. If there was an altercation in a home, for instance, the couple come to the Bale or come to that religious leader for mediation. And so the question is, what advice is being given? Because this is a community that is, as with many communities in our part of the world, steeped in a lot of traditional practices that encourage women to be subjugated. And so we realized that we needed to invite stakeholders into workshops so we could start to encourage not necessarily a change in mindset, because it's very difficult to change mindset over a short period of time. This is something that attitudinal change occurs over a longer period of time. But you can start with knowledge base. You can start by informing. You can start by showing, again, objectively, why it's good to be able to say that the women in our community are also heard. And we've started to do this in community programs. We work under a specific umbrella program called the Gatekeepers Program. Again, it's actually where ACT and WARIF's story began.
Oh, awesome.
And we realized that in working in rural communities especially, there was a trust issue, because we were coming into their community to tell them about very sensitive issues that were not openly discussed. And so we needed the partnership, we needed the buy-in of the stakeholders that were resident in these communities. And they needed to be stakeholders that were trusted, they needed to be stakeholders with spheres of influence, and they needed to be stakeholders that cared. So the natural primary stakeholder through the healthcare system was that traditional birth attendant. This is an informally trained, mostly women, there's some men, who stand in the gap and provide healthcare to not only expectant mothers, but also to women and children in these communities. And when you speak to them, they would immediately tell you about the multiple cases of abuse that occur, because they're also the natural custodian of the secrets of these women. So the women come into their clinics, they share with them, they have full access to the woman, because, again, she's a trusted member of the society and the community. But unfortunately, she doesn't have a toolkit to help the woman, because they've never been trained on cases of gender-based violence. So it was immediately apparent to us that we needed to look at that. And it was the same with the police. The police are the natural custodian of the judgment when one wants to seek justice in these cases.
Yes.
But again, we found that if you have a community, that there's a trust issue or a disconnect between the community women and the police force, then she's probably not likely to want to go to report a crime. So then it was important to close the loop. It was important, again, to share stories. It was important to express concerns. And we created a workshop where we could then inform on protocols and processes, the importance of, for instance, seeing women at our clinics within a 72-hour window after an event, because that post-incident period is where we could retrieve the necessary forensic medical specimens, so we could assist in ensuring that the perpetrator was apprehended. It was the same with religious leaders, because, as I mentioned, they're natural mediators. So again, if we're able to get them together in a workshop setting, and again, give the necessary toolkit in changing the narrative of these women in the communities, we were able to, again, see the traction. So with ACT, if I may start the ACT story.
Okay.
We, in 2017, decided that we were going to train these traditional birth attendants for the very first time on cases of gender-based violence, for them to be first responders. When they see a case, what would they do? What toolkits do they have? What documentation would they be able to put down? And where do they then refer the cases to? And with the ACT Foundation sponsorship, we started with 500 traditional birth attendants from 5 local government areas in Lagos State. And it was transformative. These were women that had never been trained before, that were suddenly empowered with training and knowledge and a referral system. In the first year of this program, we saw 200 new cases at the WARIF Rape Crisis Center from local government areas that we would never have heard of. And the women would never have been referred to us if we hadn't implemented this program. I mean, since then, we've had sponsorship for 3 additional cycles with ACT Foundation. We've expanded the program to include even more traditional birth attendants. We're now up to, I believe, 3,000 plus and counting. We've also scaled outside of Lagos.
Wow.
So now we're in Ogun State with an additional 4 local government areas there. We've completed all the local government areas in Lagos State. So we can proudly say that thank you, ACT. We're now 20 and counting.
Okay.
And then we went further. We thought to ourselves, we have these other stakeholders. So why don't we address that issue, like you said? Invite the police in as our secondary gatekeepers. Invite that religious leader in as our tertiary gatekeeper and close the loop. Have access to healthcare, have access to justice, and have access to leadership in a community setting. And then you have a whole community that has all the ready available stakeholders to assist when these cases occur. In terms of referrals, we encourage all our traditional birth attendants by creating a clinical pathway to refer cases to the nearest sexual assault referral center. In Lagos, WARIF being the one we use. In Ogun State, we use the Ogun State Sexual Assault Referral Center for those referral services.
Wow. Okay. Thank you so much. This has been, I was just listening and enjoying the entire story. And this has been really beautiful. And thank you for, just linking it up to where ACT Foundation came in. I was going to definitely ask that question,
I figured.
right? So, but then one question I'd love to ask before I ask you to share one or two stories, maybe just one story a success story that you're really passionate about, that every time you think about that story, you're really proud of what you've done with WARIF. But before we get to that, I want to ask, would you say WARIF is winning? It's been almost 8 years.
Oh, yes. I mean, when you look at the problem, you could get overwhelmed with the numbers because you say to yourself, well, how could I possibly say I'm winning when I've just said that there are 10,000 girls every day being addressed? But for me, it's about every girl is a win. Every case is a win. Every day that we wake up and we go into a new setting and we implement a program and there's awareness now, that's a win. Every time we have that boy that decides, no, I'm not going to be complicit in gang rape. I'm actually going to stand in the gap for this girl. That's a win. Every time a young woman goes home and is able to say, no, the lecturer was not able to fail me because I refused sexual advances, because with the WARIF program, there were proper policies in place and I was able to report him. That's a win. So yes, I would say we're winning. A lot more work to be done. We're nowhere near where we would like to be, but every girl and every woman deserves the right to live in a society free of violence. And that's our goal.
Amazing. Okay, now I think this is a great time to talk about a story that in your journey working with WARIF or leading WARIF, I would say, one story that always stands out for you.
I'm always asked that question and I can't think of one story.
Okay.
Every time I pause and I think, what one story resonates? I just see so many smiling faces. I see the resilience of the market women that we see. I see the young girls that come to the WARIF Rape Crisis Center. I mean, this is a center that's in Yaba. It's a walk-in facility, no red tape. Beyond the forensic medical examination, we offer treatment, we offer testing, your HIV test, your your pregnancy test. And then we give the necessary post-exposure drugs like the morning after pill, like I was about to say, as well as the prophylactic drugs against HIV. And then we start the counseling process because the emotional trauma is just as important as the physical. And as I said very briefly earlier in this podcast, we then look at the welfare because Nigeria is not a welfare country. These women do not enjoy being abused, but they're not financially capable of leaving these homes of violence. They would like to seek justice, but where do they get legal aid from? And they would like a vocational skill so they can earn, but who's giving them that? So with our program, especially in the rural community with these women, we're able to provide that. And then you're able to see the transformation. You're able to see women that suddenly, even though they were semi-literate, because they've been empowered with the knowledge of opening a bank account, can actually keep their money safely. You're able to see those that opted to apprentice with a vocational skill, facilitator, able to start a business. And you're able to go back a year's time and you're able to see her business grow. Those are the things that make us smile. Those are the stories that, as you said, resonate. And the same with the children. Children that ordinarily are in homes of violence, that are suddenly smiling because they're safe. Young girls that suddenly appreciate that they can go and speak to an organization or a counselor about challenges in school. And then boys that are struggling, like I said, in institutional violent homes, that suddenly recognize that, I can change my narrative. I don't have to be this person. These are all stories. These are all amazing, fascinating stories. And I can stay here all day listing them all. And everyone is just as special as the other.
Fantastic. So good to hear. And just listening to you, it's obvious that you're very passionate about what you do. I'd just love to ask, are you currently encountering any challenges with what you do that you wish, if this particular challenge is out of the way, would do a lot more? Aside funding, I guess.
I was like, I'm assuming that the big white elephant in the room is not one of the reasons that I would say, or rather one of the challenges that I would say. But yes, besides funding, I think just we're just working in an environment where our cultural practices, Nigeria is such a beautiful country. Our heritage is one that we're all proud of. It's colorful, it's vibrant, and various languages, our culture. And it's one that we should and continue to be proud of. But sadly, we also have cultural practices that are encouraging this violence with girls and women. And so therefore, we have women that are ostracized and can't speak out. We still have the stigma of rape. And so again, she's not allowed to speak about it, whether it's because it's, as 98% of the time is the case, it's a family member or somebody well known to her. And so she's either been threatened or she's been gaslit, and so therefore she can't speak on it, or whether because she just doesn't have the resources or enough information as to where to go to seek these services. So I guess for me, the challenge would be changing that dynamic, changing the dynamic where women are forced to remain silent and having communities become better bystanders. Enough of the shaming and blaming. Let's stand with the survivor. Let's show her that, no, the perpetrators can't continue with impunity because we're turning our heads away. I think that for me would be a significant change in this fight against gender-based violence.
Great. Thank you. Last question. No, second to the last question. What do you see? What's the future you see for WARIF?
I see WARIF scaling with regards to the programs that we implement. So therefore, I see more women being assisted. I see us going beyond state lines, which we've already done, but tackling this issue properly in all 6 geopolitical zones. I see us going beyond country lines and being a truly pan-African organization, because many countries similar to ours have the similar challenges. And so therefore, as I mentioned, there's always room for collaborative and partnerships whereby we can then come together and tackle this problem as it should be, as a greater force.
Awesome. Now, thank you for that last line, because it leads me to my last question. So you talked about collaboration, partnerships. Say I want to partner with you, I want to collaborate with you. How do I reach you? Where do I find you?
Oh, well, you can start with our website.
Okay.
You can check us on all our social media platforms, whether it's Twitter, or I guess it's X now.
Yeah.
And Instagram, as well as Facebook. We are found in all the social media online media houses and platforms, as I mentioned before. But beyond that, also the traditional publications. We have featured articles monthly in many newspapers. We also have an 0800 call line, which is 24 hours, as well as our email and other contact details, which are readily available on our website, or I'm hoping you'd be able to make it available to anyone that's listening to this.
Okay, thank you so much, Doctor. It's been a very beautiful conversation just speaking about this and sharing your story, the WARIF story. It's really very exciting to learn how far you have come and where you're headed. And I wish you great successes ahead. I'm sure that, especially, it's the Women's Month, and it's the month where we celebrate all our achievements, and it's also the month where we encourage ourselves to do so much more. So I'm certain that there's so much more to be done, and I'm sure that WARIF will do really great. So thank you for coming.
Well, thank you so much for having me. I think as a final word, I would like to encourage everyone, women, girls from wherever, to please seek help. If they're survivors of any form of violence, you're not alone. WARIF and other organizations are held to help. Our 0800 helpline that I just mentioned is 0800 9210 0009. I repeat, 0800 9210 0009. You're not alone. It's a 24-hour free service. Thank you.
Thank you so much for coming. This has been really great, and it's been really beautiful just learning about the WARIF story and talking a lot about gender-based violence. There you have it. We are excited about what WARIF is doing, and we know we're also celebrating various other organizations who are doing this and helping as many women as possible. Thank you so much for being on ACTPod today. We'll be back again with another exciting conversation on this platform. Watch out for us. Have a beautiful day. Bye.
Thank you for listening to ACTPod. For inquiries and feedback, please reach us on actpod@actrustfoundation.org. Follow us on social media at actfoundation_ on Instagram and Twitter, and Aspire Coronation Trust Foundation on Facebook. The show is proudly powered by Aspire Coronation Trust Foundation. ACTPod, our story, our continent.